Hi everybody, it's Dr. Charles Modlin, your friendly urologist and health equity leader, here with another health equity brief. As you recall, these health equity briefs are opportunities for me to impart to you, the listening audience, and for you to spread the word about important health information that you need to know individually to maintain and improve your health status as well as that of your family and community. So what is the topic of today's health equity brief? I've decided and thought about this for a while. One of the health disparities that we commonly see, especially in African American populations, is vitamin D deficiency. It's not something that we think of all the time or talk about, but I want to spend about 5 minutes with you and outline what is vitamin D, what is the importance of vitamin D, and what are some of the ramifications and side effects of having vitamin D deficiency. So vitamin D, it's produced by the skin through the skin's absorption of ultraviolet light from the sun, of course, and it's processed into other forms both in the liver and kidneys. But vitamin D deficiency is significantly more common in African American populations compared to whites, affecting both adults and children. The disparity is driven by differences in skin pigmentation, genetics, diet, and socioeconomic factors. Vitamin D is essential for bone health, immune function, and cardiovascular health, making deficiency a serious public health concern. Vitamin D deficiency also has been linked to developing various forms of cancer as well. So let's talk about the incidence and mortality rates associated with vitamin D deficiency. So African Americans have up to 80 to 90% prevalence of vitamin D deficiency, compared to only about 30 to 50% in white populations. Severe deficiency is more common again in African Americans, leading to higher rates of complications such as osteoporosis, cardiovascular disease, and immune dysfunction. There are higher mortality rates from chronic disease linked to vitamin D deficiency, again, cardiovascular disease, diabetes, and cancer. What are some of the causes and risk factors for vitamin D deficiency? Well, melanin and skin pigmentation are major determinants. Again, darker skin reduces the ability to synthesize vitamin D from sunlight, thus leading to lower levels of vitamin D in our bodies. Another risk factor, limited sun exposure. There are certain cultural practices, indoor lifestyles, sunscreen, etc., use that actually can potentiate vitamin D deficiency, reduce sun-induced vitamin D production. Dietary intake, lower consumption of vitamin D in vitamin D-rich foods. Fortified dairy products, fatty fish contribute to vitamin D deficiencies. Genetics, vitamin D deficiency or variants in vitamin D binding proteins in the body may result in lower bioavailability of vitamin D in African Americans. Obesity is related to higher rates of obesity in African Americans lead to vitamin D sequestration in fat tissues, meaning that vitamin D gets trapped in the fat tissues, thus reducing its availability to the rest of the body. Chronic kidney disease. African Americans have higher rates of chronic kidney disease, which impairs the activation of vitamin D in the kidneys. So again, we talked about biologic factors, genetic factors, socioeconomic factors, limited access to healthcare, food deserts. All of these contribute to and reduce opportunities for early diagnosis and vitamin D supplementation. What are some of the signs and symptoms of vitamin D deficiency? Well, bone and muscle pain, fatigue and weakness, frequent infections and poor immune function, depression and mood changes, hair loss, slow wound healing, muscle cramps, again, and weakness. The diagnosis of vitamin D deficiency is through blood testing. Serum 20-hydroxy vitamin D test. That's a blood test where we can measure vitamin D levels in the blood. Deficiency is defined as a level lower than 20 nanograms per mil, while insufficiency is 20 to 30 nanograms per mil. When you go to your primary care provider, other healthcare providers, ask them to run a vitamin D levels to see where your levels are. So treatment of vitamin D deficiency is vitamin D supplementation. That's the primary treatment method. Dietary changes also can be effective in increasing your vitamin D levels, increasing intake of vitamin D rich foods, salmon, fortified dairy, eggs, increasing your sunlight exposure, encouraging 15 to 30 minutes of direct sunlight exposure daily. But again, the duration of needed sun exposure varies by skin type and location. Types of vitamin D and metabolism. So there's vitamin D2. It's called ergocalciferol, derived from plant sources. Vitamin D2 is less effective in raising one's vitamin D levels. Then there's vitamin D3. That's cholecalciferol. It's derived from animal sources, and sunlight is more effective in increasing your vitamin D levels. So vitamin D3 supplementation is better than vitamin D2 supplementation. So how is vitamin D produced and metabolized? UV ultraviolet exposure converts one form of vitamin D into vitamin D3. Liver conversion, again, vitamin D3 is converted into a more active form, 25-hydroxy vitamin D. The kidney also participates in converting the one form of vitamin D into the more active form of the calciferol. The best vitamin D supplement, as I indicated, is vitamin D3. It's superior to D2 due to better absorption, longer lasting effects. Dosing really depends on what your vitamin D levels are, and generally physician will and your healthcare provider will direct you in terms of what your dosing of vitamin D supplementation should be. If you have only mild deficiency, it's generally 1 to 2,000 international units a day. And again, these can be obtained over the counter. If you have severe deficiency, you may be recommended to receive 50,000 international units per week for 8 weeks, followed by maintenance dosing determined by your healthcare provider. And again, these are in the form of oral capsules, oral supplementation. So again, the pathogenesis of vitamin D deficiency in African Americans: high melanin levels, reduce the ultraviolet light absorption, and that actually results in lowering of your vitamin D production. Genetic differences in the vitamin D binding proteins, which affect the bioavailability. So again, some complications. Obesity is another. I mentioned that before. Risk factor. So some of the complications of vitamin D deficiency: osteomalacia. That is a condition where you develop soft and weak bones. You can develop, children can develop rickets if they have vitamin D deficiency. Osteoporosis, bone fractures, increased risk of hypertension, heart disease, weakened immune system, increased risk of infections, diabetes, and insulin resistance. Muscle weakness, increased fall risk in older adults. Very important that you know what your vitamin D levels are. Chronic kidney disease reduces vitamin D activation. Chronic kidney disease patients require active vitamin D due to their impaired conversion. There is a relationship between vitamin D and calcium absorption, and vitamin D is essential for calcium absorption in the intestinal tract. Deficiency of vitamin D leads to hypocalcemia, low calcium levels in the body, again contributing and causing bone demineralization. if you have low levels of calcium, that calcium is going to be reabsorbed from your bones, leading to weakened bones. That increases your risk for bone fractures. Hyperparathyroidism can develop in response to low calcium, worsening your bone loss. The parathyroid glands, again, contribute to absorption of calcium from the GI tract. Vitamin D deficiency impairs calcium absorption, increases risk for bone fractures, particularly in postmenopausal women and the elderly. There's an association between vitamin D deficiency and cardiovascular disease, as I mentioned, and that leads to increased risk for hypertension, heart disease, and stroke. Contributes to arterial rigidity, stiffness, peripheral vascular disease, endothelial obstruction, promoting atherosclerosis, hardening of the arteries, poor circulation, leg pain, can also be sequelae to low vitamin D levels and vitamin D deficiency. So again, I've highlighted what is the importance of vitamin D, the different supplementation that is available. Vitamin D3 is more effective than vitamin D2. I've talked about some of the risk factors, some of the complications, some of the symptoms, signs and symptoms. So my message to you all out there is know what your vitamin D levels are, understand what your risk factors are, understand ways in which to mitigate potential vitamin D deficiency, talk to your healthcare providers, and if you haven't had a vitamin D level drawn, ask your primary care provider to order a vitamin D, or ask your friendly urologist or any other healthcare provider that you may be seeing. We can all place the orders and put those orders in. So vitamin D deficiency is something that you all need to know about. So please join me again tomorrow for another health equity brief. Don't know what I'm going to talk about yet, but stay tuned and look forward to speaking with you again. Thank you.